would like to take this opportunity to thank NIIT Stackroot for allowing or giving us a platform, Jagriti, to be able to present our story to the esteemed audiences. Thank you. What's up? Sorry. We are essentially a product company focused on creating knowledge management-centric intelligent IT systems. We use digital platform approach with a focus of improving patient outcomes and also use data insights to create scientific publications for general use. Let's take an example of a genetic blood disorder called thalassemia. If you are a patient who is thalassemic, your body is incapable of producing healthy red cells. This means that every 20 days, you will need blood transfusion, blood from someone else for life. India is the thalassemia capital of the world. 90% of patients in India do not have access to proper treatment. 50% of them die before the age of 26. In developed countries, patients with thalassemia live near normal lives. They get married. Thalassemia, although it's very easily preventable, and there is a curative option using bone marrow transplantation. We have an enormous data complexity when it comes to dealing with thalassemia. Thalassemia can get detected as early as when the patient is 6 months old. The RT-PCR test or the HPLC data, that test that you do today, can be required 20 years later when there is a chance for cure. So we need to store the data, medical data for life. There is a diverse amount of medical data that we need to look at. Pathology, CBCs, endocrine tests, ferritins, molecular lab, molecular data, HLA, scans, ultrasound scans, DEXA scans, X-rays, chromatography readouts, RT-PCRs. We need to capture each one of them. Whenever there is a medical emergency that happens, we need to look at every data point that you've captured to be able to pinpoint what happened. This is akin to finding needle in a haystack. Not just that, we need to make sense of all the data that we've captured to bring in a coherent solution that offers a curative option for these patients. And not just that, what we also need to do is there are pediatric hemato-oncologists, doctors, nurses, center coordinators. They need to have accurate insights to be able to deliver what is the next best action that one needs to do for the patients. Let's take a few examples of the data complexity that we have. The first one is a gold standard for detecting thalassemia. You see here is a chart that has peaks and some areas. It requires a trained pathologist some time to be able to decipher this data and give results. We have sort of converted this data form to a digital form and interpreted the results along with the raw data electronically. Then we have RT-PCR. All of you guys would have heard about RT-PCR in COVID-19. COVID-19 is just one of the multiple mutations that we have to look at. Then comes chimerism. This is the pinnacle when it comes to detecting the complexity of molecular tests. Normally, what happens is during bone marrow transplantation, the donor cells are given to a patient. And this test tries to detect how many donor cells are there in a patient. Normally for tests like RT-PCR, you have just one thing to find out, whether you have COVID or not. Here the result itself is a mixture. So this is one of the few complexities that we look at. Let's take a look at the analytics architecture. There is one rule that we follow. We don't say no to any kind of data that we get. In the age of IITs, whether it's measuring ambient temperatures or taking real-time data from cardiac monitors, we capture all. From lab systems, not just the results that you get from this lab data, but actually the raw data we capture and also try to find inferences that helps us for analytics and insights. Then, we are API first. We have endpoints for each and every data system that we have. And we connect to about 25 different vendors wherein we transmit data on a minute-to-minute basis. We have the variation in terms of data API ranging from simple FTP-based file data transfer to encryption two-way handshake using 2048 encryption. And then we have complex data. Let me give an example. All of you guys would have used a microscope to see a slide. We capture not just the cells, but also the movement of the cells with our platform. And then we have text data. Let me give an example of this. For a single patient who comes for transplantation for cure, we generate about 1,200 drug orders. For each of the drug orders, we capture the individual drug, the injection, the vial, even the cotton syrup that we use. The entire inventory we capture, and it is auditable. Not just that, even the medicine that is being given, who gives the medicine and when, whether the medicine is actually linked to the treatment plan or not, we capture that data as well. Once we have all of the data, most of you would have known Drupal as a CMS for creating blogs. Let me share how we use Drupal to capture data. Drupal is a fantastic backend when it comes to data modeling and storage. We've been using Drupal for more than 10 years. I had hairs back then. We're still using Drupal. This Drupal allows us to be composable. It allows us to scale the way we are capturing data. Once we have data, then we have a host or plethora of microservices. It doesn't matter what technology we use. For us, we are technology agnostic. What is the best way for us to process this enormity of data is what is important. Whether it is R-based, whether it is Java, something, it doesn't matter. We will use what is best available, spin up a microservice for it, and try to use that as much as possible. Whenever we find a new solution, we then switch back, then start using that service to get access to the insights that it can provide. All of this data that is sort of handled through those microservices needs to be harmonized. That is when the pre-process cleanup and transform happens. The data is harmonized to be so that it feeds into the core systems that we have. This is the solution for prevention of thalassemia, solution for management of thalassemia, and solution for cure. And one of the most important aspects of this is the analytics engine. We do all kinds of analytics that we have, whether it is exploratory, predictive, or prescriptive. We need to find solution that will take the insight that we have to the next level. Once we have all of this analysis done, then the next step that we need to look at would be, what are the actions that we can do? Let's take the first aspect. Let's take an example of thalassins. In a very low-cost thalassemia setup, a coordinator who has no medical background just needs to know how to use a computer. This would be a center that takes hundreds of patients. The patient would have come to the coordinator, and the coordinator just needs to enter data. The system is smart enough to detect changes in the patient profile and silently compute what is the next best action to be done. There are 25 different actions to be done, but it tries to find and show the next best action and uses REG, red, amber, green, to show which is the highest priority action that should be taken place. This is so paradigm shifting in a way that this has really made thalassemia management truly low cost, because now physicians is only required for intervention. Management can be handled by the system and coordinator itself. Then we allow users for looking at the survival curve, survival outcomes of patient, submission to international registries, or even creating research papers without the need for an expert statistician. Sometimes, when a user, there are certain things that a user understands when they start using the system. There are other things that you need to make them aware of. Like, let's say, when a nurse tries to deliver a medicine, if there is an expired medicine, the system needs to stop them. Right? When a physician is trying to, give a next medicine order, are there any other medicine in the treatment plan through which there is an interaction that might not be good for the patient? The physician needs to know. Or just, to wake up a sleeping project manager when there is no data coming from a sensor. So there are different kind of alerting system for different role-based personas. And finally, we have dashboarding that we have created. The idea is that, let's take an example, patient dashboard. Every single insight that you need when you access a patient is available there. Every bit of information that you need and what are the steps to be taken place is made available in the dashboard. Picture this. So much of data is coming, and we have very specialized pediatric oncologists who are handling this patient. Some of this patient would come for, just for routine follow-up. Some of this patient would have come for, would have an emergency, maybe through the various data that we collected. How do we effectively schedule them so that we are able to take care and handle intervention in time is what we do through anomaly detection. The system is capable of automatic calendaring scheduling and to be ensuring that the intervention happens on time. Over the years, we have used analytics on data, and we've used, sometimes the system has given us answers to questions that we didn't even ask. So we said, what would we do with this exploratory analytics? And we said, let's publish them. So we have published a lot of data in medical scientific journals. We'll talk about that later. The centers that have used our system have gained 10 to 20% improvement in overall outcomes. We talked about sustainability. So we don't use a cluster to do data analytics. What we do basically is we use lean periods when the system load is low and preemptively schedule analytics so that we ensure that the system load is at certain level. There is a system that detects, there's a grave medical emergency or situation called GVHD, graft versus host disease. Our system is able to detect the pattern weeks before and be able to take intervention on time. For patients who are there in thalassemia management setup, what generally happens is they are overloaded with so many patients, right? 300, 400 patients coming in. And the system ranks the donor in a way that the worst performing patients are there, the top 10 patients are available, so that we do not lose a child. The intervention comes to them on time. The system is able to do that. The general, I think since there's a positive time, let me just try to rephrase this. So we don't silo on what aspects of patient management that we do. Right from the fetal state the patient is in, to prevention much earlier than that, to the entire management as well as cure. We take care of everything. Since, for example, when it comes to prevention, we are talking about prevention at remote villages. We are talking about Anantapur. We are talking about Tumkur. So we would want to ensure that we build smart workforce who are able to use this intelligent IT system to make meaningful decisions. We would also want to improve clinical efficiency so that these patients live longer. At the same time, improve patient experience and reduce risk. Over the course of years, we have made more than 25 international publications. We are an engineering company, but these are international medical journal with an impact factor of 3 and above. American Society of Hematology, Nature, Blood. Most of the major, and our findings have been path-breaking in the way that they have actually caused practice-changing initiatives in multiple countries. first slide that you can see is are where two nurses are there. They have a laptop, they have a scanner, they have a barcode, but what they don't have is paper.
I'm sorry, I'll jump in. We are running short of time. If you really want to see what digitization can do, half a kilometer away from here, you have this unit. This is a transplant unit. This is the nursing station. Do you see paper? Do you see clutter? Digitization and this architecture, which started from treating people in OPDs, has gone all the way to transform the way we deliver healthcare. And I would like to take this opportunity to welcome any of you who would like to see this in action just half a kilometer away. This is a dream come true for all of us, unlocking medicine through technology.